I'd like to share today is I think many people don't understand what we do when we do a physical. This has to do with physical on animals and in the human side, physicals on people. But today we're only going to do animals. But the primary first thing in examining and finding out what's going on with a person's pet is the history. Why is this dog here? Why did you bring this dog to our clinic, and how can we help you? In order to help this dog or the pet or the owner, we have to have information. And this we rely upon technicians. Trey Moyer is with us today. This information is very, very important. He extracts, or the technicians extract information from the owner, and then as the veterinarians, we come in and we actually get more information because our information will come from a different point of view. Once we have the information from the owner in reference to what is going on with their pet at this time, then we can begin our physical exam. In a physical exam, it's kind of basically it's nose to tail, and that's kind of it in a short form. The other thing is consistency. When we do an exam, we are taught that we need to start from the beginning, and that I start mine from the nose and the mouth, to all the way to the tail, and you go through different organ systems. The first thing that we always do is we pick up the dog's head, and we like to look at the nasal openings or the nares and make sure there's not problems there. I always like to look at the mouth and get that done pretty soon, because if you don't know the personality of the dog, you want to look in the mouth while he's still happy with you, not later when he's not happy with you. Looking at the skin at all times, no matter where you are, we should be looking at the skin of the face and the ears right now. The skin in the eyes, the eyelids, the eyes themselves. Are there any issues in the interior part of their eye or in the areas surrounding around the eye? When we look down further into the eye, we need to use an ophthalmoscope, and that gives us the ability to use different lenses in order to see if there are different lesions or problems with the eyes. We'll also look for discharge from the eyes. Do we have a problem within the eyes that causing a discharge? Is that normal for the dog, or is there actually an issue with it? Light-coated dogs are going to show staining a lot more than dark-coated dogs. Ears. Ears are lots of problems with ears. Ears are in the top 5 things that people bring their pets to the clinic for. They have not only issues with the skin potentially on the outside of the ears, the inside of the ear flap and the canal have many, many problems potentially. And the reason I bring that up is this is what I call the wash rag, the floppy wash rag, wet wash rag. And what that does is that folds over the animal's ear canal. It traps in moisture, sets it up for yeast and bacterial infections. For this reason, we want to make sure to examine both the external part of the ear and use an otoscope and look on the inside of the ear. Going on down the neck, we want to make sure to check for lymph nodes, lymph node enlargements underneath the throat. Many times, if these lymph nodes are enlarged, we have potentially dental problems, mouth problems, ulcers in the mouth, or upper respiratory. We want to watch for nasal discharge again for respiratory problems before we listen to the lungs and the chest area. It's best many times you have to stand up and reposition individuals. They don't like, some of them don't like to cooperate. We have a lot of dogs though that just don't really care, and they welcome the attention. We want to check the legs and look for lymph nodes underneath the arms or the axilla and make sure that there's not any issues there. Obviously, we've just looked at the neck, and we want to look at the neck region here. I check, most of the time I'll check, make sure collars are not too tight and there's not an irritation there, because it can cause skin irritation underneath the collar, so we want to watch for that. After we check both legs as far as the lymph nodes are concerned, we want to run our hands down and see if there are problems with elbows. Is there an issue in the joints? Is this dog painful or sensitive? Are there swelling that is associated with any part of the leg itself or the toes? On the toes, we can notice, actually even on this dog, there's some staining there, and that gives us a clue that this particular dog, and his name is Bo, has been licking and chewing on his feet. That tells us some very, very good things about what he is doing. Between his toes, do we have any infection? Are there any cracked pads? Looking at each individual toe, are there cracked toes? Most people will know when an animal has an issue with a toe or a toenail because they'll bring the dog in for lameness or an acute or sudden onset injury. Check both feet and make sure that we've got the front feet covered, and make sure that we don't have any swelling again or any cracks or irritations in between the toes. Working our way back, we want to feel along the thorax, along the chest wall, up on the top surface, underneath here on the rib cage, and here in the abdomen. At this time too, many times we will grade the dog's body condition score. We'll determine what is its weight situation. We use a grading score of 1 to 9, 5 is normal. Anything under 5 is underweight, anything over 5 is overweight. And we want to have kind of a waist here. We don't want fat accumulation in here, so we'll be checking for that. This dog's body condition score is 5, which is the normal range that we want. That is the normal number we're looking for. On the abdomen, we want to feel the abdomen. We want to actually go beyond just the skin of the abdomen and feel for organ systems. Try to visualize what's there. I'm looking for a bladder here, possibly prostate, because this is a male dog. Further forward, we may be looking at the spleen, trying to see if there's any issues there. And as we get even further forward from there, we'll see if we can pick up the kidneys on either side, and then stomach and liver in that area. Many times we can pick up abnormalities just by using our hands, and this is what we were taught in coming out of school, is using your hands and your senses first to determine what you see and what you hear and what you smell. As we move towards the back, we want to pick the dog up if the best we can. Now Bo's the right weight for me to lift. He makes it my job easy right now. And Trey helps me out a lot by keeping him steadied in the middle. We want to again check for lymph nodes in behind the legs in the inguinal region. We want to feel if there's any hernias associated there. Hernias can also be in the umbilicus. We want to make sure we do not have hernias there. And then we come on down to the knees. Many of the small dogs have problems with these, and even the large dogs also, where they can have problems with their kneecaps and with some of the tendons and structures in the knee themselves. He actually has a little bit of an abnormality in his left rear leg. Lymph nodes again here, we're checking the popliteal lymph nodes behind the knees on both sides, and then come on down with the feet again and feeling the tendons and the bone structures, looking for swelling, looking for any irritations, and looking for any cracks in and out of both, well actually on both rear feet. Same thing on this side. Again, we're going to look at the feet and the structure and see if there's any swelling or abnormalities. Toenails, dogs are really bad about breaking toenails off at the skin surface, at the growth areas. And when this happens, they're very, very painful. The animal will be limp. You'll think they'll have a serious leg injury, and it can be something as simple as a toe. Around the tail and tail head, we'll want to look at the rear quarters, primarily between the anus and the scrotum. Make sure there's not any skin irritations there. Make sure there are no tumors around the anus. Make sure there is redness. Redness a lot of times is associated with allergies. Food allergies are one of the ones that we do see that. And sometimes when you have feet that have been chewed on, we have a redness around the anus, and then we have ear involvement, we can have allergies. So that gives us some key factors in trying to determine what is actually going on with the skin. The tail, he has a short tail, so that makes it an easy exam, so we're not concerned about that. The base of the tail, this is a big area where we see where there are flea problems. I know that Bo is under good flea control and he has no issues there, but this is where a lot of the fleas congregate here around the base of the tail. In dogs that I can lift up easily, I lift them up and look at their abdomen. That way I can check the whole abdominal area where there's less hair. I can check at the scrotum, the prepuce, and I can look up underneath the thorax and check out the mammary areas, and then underneath the both front arms. The bigger dogs I have to get on the floor with because they're easier to handle. We can get them to roll over and we can examine the under areas in its entirety. As far as chest and lungs, we have to use a stethoscope, and I'll have to get my stethoscope. Thank you. It's nothing like having good help. We're doing this to educate and have some fun with it too. So as far as the heart, we basically are listening for abnormalities. Arrhythmias are a big issue. There are a number of types of heart murmurs. These are just the precursors to determine whether they have any serious heart conditions. We listen on both sides of the chest. There can be separate separate murmurs on both sides of the chest. There can be arrhythmias that are very evident. And there can be some serious heart diseases that many animals, or some breeds more prevalent, such as Chihuahuas, that have major hereditary defects that do affect the quality of life and their longevity. Once we've listened to the heart, we're going to move in and check the lung field and make sure that we don't have any abnormalities there. We're going to be listening for sounds of moisture, sounds of crepitus or popping. We're going to make sure that he is breathing in and out. We want a nice even airflow on both inspiration and expiration, and we listen for any sounds that may give us any indication there. While I do use the stethoscope on just the chest area, I will also, not just the chest area, I'll also listen to the trachea and listen for any changes in there. Dogs have problems with their tracheas where they collapse. These small breeds like this are prone to having issues like that. The other thing sometimes too, depending on what I'm looking at, if there's respiratory issues, then I will actually listen to the frontal sinuses in the skull itself and see if there's any airway problems there. In summary, the main thing we do this is a physical exam. We want to know what the physical condition of the animal is. If there are issues there that we can help with, things that need to be addressed for the dog's concerns and for the client's concerns, this is why we do the physical.